this is Dr. Emma Hitt-Nichols, and this is the information on the latest U.S. FDA approvals, July 8th through the 12th, 2024. This comes out every Monday, and I hope that you'll tell your colleagues about this podcast if they want to stay up to date with the latest approvals. First up this week, the FDA has approved blinatumomab, Blincyto, for the treatment of adult and pediatric patients 1 month or older with CD19-positive Philadelphia chromosome-negative B-cell precursor acute lymphoblastic leukemia, BALL, in the consolidation phase, regardless of measurable residual disease status, MRD status. Blinatumomab was previously approved for CD19-positive BALL in first or second complete remission with MRD greater than or equal to 0.1%, and for relapsed or refractory CD19-positive BALL. Blinatumomab is a bispecific T-cell engager therapy that targets CD19 surface antigens on B cells, thereby enabling T cells to recognize and eliminate malignant B cells. BALL is an aggressive form of blood cancer that begins in immature B-cell lymphocytes in the bone marrow. It is the most common type of acute lymphoblastic leukemia, accounting for about 75% of cases in adults. This approval was based on findings from the Phase 3 E1910 clinical trial conducted by ECOG Akron Cancer Research Group. The study showed that blinatumomab added to multi-phase consolidation chemotherapy significantly improved overall survival compared to chemotherapy alone. The 3-year overall survival rate was 84.8% in the blinatumomab plus chemotherapy arm versus 69% in the chemotherapy arm, with a hazard ratio for overall survival of 0.42. After a median follow-up of 4.5 years, the 5-year overall survival was 82.4% in the blinatumomab plus chemotherapy arm compared to 62.5% in the chemotherapy arm. The approval of blinatumomab was granted to Amgen. Also this week, the FDA approved roflumilast cream 0.15%, also called Zorvye, for the treatment of mild to moderate atopic dermatitis in patients aged 6 years and older. Roflumilast cream 0.15% is a selective, highly potent phosphodiesterase 4 PDE4 inhibitor used as a once-daily steroid-free topical treatment to provide rapid disease clearance and significant itch reduction. It is designed for long-term disease control. Previously, roflumilast cream 0.3% was approved for the treatment of plaque psoriasis in patients 6 years and older, and roflumilast foam 0.3% for seborrheic dermatitis in patients 9 years of age and older. Atopic dermatitis is a chronic inflammatory skin disease characterized by itchy and inflamed skin. It often impacts quality of life through symptoms such as rash, itch, and sleep disturbance. The approval was based on findings from the Integument 1 and 2 studies, which were Phase 3 parallel group double-blind vehicle-controlled studies involving 1,337 patients. The studies demonstrated that 31.3% of patients in the roflumilast group achieved validated investigated global assessment AD success at, and that's also called a VIGA-AD, success at week 4 compared to 14.1% in the vehicle group. Additionally, 41.4% of patients in the roflumilast group achieved clear or almost clear skin on the VIGA-AD at week 4 compared to 21.4% in the vehicle group. Other significant outcomes included a 75% reduction in the EASI, eczema area and severity index score in 42.7% of the roflumilast group versus 20.6% of the vehicle group, and a 4-point itch reduction in 31.9% of patients in the roflumilast group compared to 16.6% in the vehicle group. The approval of roflumilast was granted to Arcutis Biotherapeutics. The FDA has approved a new 6 mg single-dose pre-fill syringe for faricimab SVOA, also called Vabysmo. Prior to this approval, Vabysmo was available only in a single-dose vial. Faricimab SVOA is a vascular endothelial growth factor, VEGF, and angiopoietin-2, Ang2 inhibitor, indicated for the treatment of neovascular age-related macular degeneration, AMD, diabetic macular edema, DME, and macular edema following retinal vein occlusion, RVO. The new pre-filled syringe provides the same medication in an alternative ready-to-use format, facilitating easier administration. The 6 milligram single-dose pre-filled syringe is expected to be available in the coming months, while the 6 milligram single-use vials will continue to be available. Vabysmo is administered by intravitreal injection, with each pre-filled syringe or vial intended for the treatment of a single eye. The approval of this agent was granted to Genentech. And now a word from the supporter of this podcast, Learn AMA Style. If you are someone who writes about medicine or science, you're an MD, PhD, you're a medical writer or pharmaceutical industry person, then you need to visit learnamasstyle.com. At that website, there are several free downloads that will help you implement AI reliably into your writing work, as well as a downloadable list of prompts that you can use and some tests and downloads on AMA Style, which is the grammatical style guide that we use in this industry. Check it all out at learnamasstyle.com. That's learnamasstyle.com. It's a light week this week for approvals, but we have a couple of PDUFA, that's Prescription Drug User Fee Act, dates coming up this week. The first one is for OX124, and that's for opioid overdose reversal. So the FDA accepted a new drug application back in November 2023. OX124 is a high-dose naloxone nasal rescue medication designed to reverse opioid overdoses, including those caused by synthetic opioids such as fentanyl. OX124, developed using a proprietary drug delivery platform, offers a rapid absorption, high bioavailability, and enhanced stability under various temperature conditions. The PDUFA date for the FDA's decision is set for July 15th, 2024, which is the date that you'll hear this if you hear it right when it downloads. The U.S. launch is anticipated later in 2024 if approved. Synthetic opioids account for 91% of all fatal opioid overdoses in the U.S., underscoring the need for potent rescue medications such as OX124. The approval of this agent would address this critical need, providing an effective option for reviving individuals experiencing opioid overdoses. The high-dose naloxone product is protected by patents until 2039. OX124 is being developed by Orexo. And then also upcoming this week, on December 6, 2023, the FDA accepted an NDA for vonoprazan, also called Voquezna, tablets for the treatment of heartburn associated with non-erosive gastroesophageal reflux disease, GERD, in adults. The PDUFA target action date is set for this Friday, July 19th, 2024. Vonoprazan is a potassium competitive acid blocker, PCAB, that provides an alternative mechanism to traditional proton pump inhibitors, PPIs, for managing acid-related disorders. Previously, vonoprazan has been indicated for the healing and maintenance of all grades of erosive esophagitis and the relief of heartburn associated with erosive GERD in adults. Non-erosive GERD is the largest subcategory of GERD, affecting an estimated 38 million adults in the U.S., with about 15 million of these individuals being diagnosed and treated with prescription medications annually. Non-erosive GERD is characterized by reflux-related symptoms in the absence of esophageal mucosal erosions, impacting the quality of life with symptoms such as episodic heartburn, regurgitation, difficulty swallowing, and chest pain. Vonoprazan is being developed by Phathom Pharmaceuticals. All right, that's it for this week. Thank you so much for listening. Again, tell your friends or colleagues. And who I think would really benefit from this podcast is medical students in medical school. You have so much information. And if you're driving in your car on the way to your next class, maybe you can listen to this and sort of just get like a little snippet of information for all of these different things that you guys have to learn. That's really tough. So have a wonderful week. Thanks for listening.